Dentists or as well first used nitrous oxide as an anesthesia, but he found inspiration in a show used by professor and chemist Garner Colton. He used it to ask volunteers from the public to inhale nitrous oxide so that he would lose sensitive and remain in a state of well-being and arousal. Dr. Wills decided to try it out for himself. When he breathed in this gas, he fell asleep, and his assistant, John Rins, performed a true extraction of a molar without Wills' complaint. Upon awakening, Wills exclaimed, "A new era for tooth organ removal! You will have been surprised too, wouldn't you?"
Well, and you know what happened before anesthesia was invented? The answer is obvious, isn't it? One of the operating rooms of the old operating theatre in London Bridge used to be one of the first to attend patients for surgery, and of course they did not use anesthesia to begin with. It was more likely to die from an infection or a smell than from the disease itself. Can you imagine that? Since they didn't have the knowledge to control the biosecurity and cleanliness of each room. Doctors used to do the operation as quickly as possible so that the patients would not die from post-operative infections. In addition, only the wealthiest patients are given alcohol to relieve the pain of each surgery. Then you can imagine the patients who didn't have the money to buy alcohol and all they suffered from their surgeries. Finally, and as very chilling fact, the implements or the hands were not washed, since they were unaware that bacteria could spread off the body of the passenger or the doctors themselves.
His colleague William Morton demonstrated in 1846 the effectiveness of ether as a general anesthetic, and in 1847 Simpson used to apply chloroform in childbirth. Ether was used until the middle of the 20th century, when other more powerful inhalatory agents, easier to handle and fewer side effects, were discovered, particularly haloth, which was in turn replaced by inflorin and in addition today by semflorin and denflorin. However, it can be said that true anesthesia was born in the 19th century thanks to the discoveries of gases.
People got used to a safer and more durable surgical accidents. Usually the surgeries were performed in less than 15 minutes, which caused a risk of infection. Back procedures, and therefore 2 out of 3 surgeries had a high risk of death of the patient. Anesthesia allows longer surgical procedures, and having the appropriate requirement for this type of practice where the person is usually informed that it will be carried out with that application and what reaction he will have after procedure ends.
And finally, thanks for watching, and I think we all learned a lot about anesthesia, didn't we?